Thank you so much for joining today's Spotlight session, which is the first one for our Coming Together for Action conference, sponsored by the Global Alliance for Behavioral Health and Social Justice. This is our first Spotlight session on framing global mental health priorities, policy, and practice through a human rights lens. We're really excited to sponsor this today. My name is Debbie Klein-Walker, and I've had a 40-year career in public health, mostly maternal and child health, research, policy, and advocacy. And I'm a past president of the Global Alliance for Behavioral Health and Social Justice. The first presentation today will be Professor Sofia Grushkin. She's the director of the Institute on Inequalities in Global Health at the University of Southern California. She also holds appointments as Professor of Preventive Medicine and Chief of the Disease Prevention, Policy and Global Health Division at the Keck School of Medicine. And she's also a Professor of Law at the Gould School of Law. She's been instrumental in developing a concept and methodology and imperial links between health and human rights, with a focus on HIV/AIDS, sexual and reproduction health, child and adolescent health, gender-based violence, and non-communicable disease and health systems. Before joining USC, she was with Harvard University's T.H. Chan School of Public Health, where she was the director of the Harvard School of Public Health's program on international health and human rights. Her pioneering work in the field of health and human rights has been instrumental in advancing our understanding of rights-based approach to health. For these reasons, it is my honor today to actually also award her the 2020 Max Heyman Award, which is one of the various awards of the Global Alliance. This award is given for distinguished scholarship in advancing knowledge about the right to health and the importance of health to the realization of other human rights. We are really pleased to present you with this award, Dr. Grushkin, and to hear your comments today as we lead off this webinar for our conference on Coming Together for Action 2020. Dr. Grushkin.
Thank you. I super appreciate that. I'm incredibly grateful for the award and really appreciate this. I just want to make sure that I'm sharing my screen properly.
Yes, perfect.
Able to see my screen? Yes. Okay. So, oops, nope, not so good. Sorry about that. Here we go. And thank you. I think that I may try to speak to you without slides to start, if that's okay. And perhaps when you receive the slides, we might go back to them. Okay?
Yes, absolutely.
If that is acceptable. I'm not sharing my screen. Is that correct?
That's correct.
Okay. And I apologize to everyone. And I want to just start by saying good morning, good evening, good afternoon to you all. It's a pleasure to be doing this. I'm grateful for the award. And again, I apologize profusely for what just happened. Let me start by saying why I chose the title Complicated. I chose the title Health and Human Rights, a Complicated but Needed Convergence in a Complicated Time. And it seems right now with the pandemic, with the crises in our political structures and the increasing inequalities that exist that are affecting us in all parts of the world, that we're really at a crossroads, not only for what the links are between health and human rights, but what they can become. And I fear in this moment that if we're not careful and vigilant, that we may end up dismantling the structures and systems that support health and human rights without replacing them with anything that's better. So that's the concern that takes me to this title. But I also have to say that fundamentally I'm an optimist, and I believe that if we educate ourselves and work together, that we can make a difference, not only to stem the tide, but actually to build back in ways that can support all of our communities, wherever it is that we live and work. And like all of us, I think right now it's impossible to talk about these issues without talking about the virus. So I really would like to frame my remarks around the virus. And so may I ask if the slides have appeared in anybody's inbox, if you could please interrupt me so that we can bring them up, okay? But what I wanted to do is to start the conversation by defining my terms, so it's clear what I mean when I'm using the terms that I am throwing out here. And the first term I'd really like to talk about is global health, because I frame health and rights within global health. And I think that global health helps us move past looking at health problems only in relationship to our own country, our own community, and our own experience. And I think each of the definitions of global health that exist bring up important issues about where we are now and what we need to address the virus, which is really about collective action and support that transcends city, state, and even national borders in ways that I think this conference is all about. In terms of human rights, what I mean is I mean what the United Nations mean, that they are internationally agreed to, and that they are about the relationship between the individual and the state, and that they set out what governments of the world can do to us, cannot do to us, and should do for us. And in terms of human rights law, it's about what governments have agreed with one another are their legal obligations to promote and protect our rights. And I can't stress this enough, that it really is about governments' agreements with one another around the legal obligations that exist. Now, there's a number of human rights treaties that exist. I guess I would ask everyone on the Zoom, do you know the human rights treaties that your government has agreed to be bound by? Because they're incredibly important for knowing what rights our governments are legally responsible for enforcing, particularly in this very complicated time. And just to be clear that every country in the world, including the United States, has ratified one, some, or all of these treaties, which makes them a common standard across all countries. So those of us on this Zoom from the United States, may I say that we are kind of an outlier. For example, at this point in time, we are the only country in the world that has not ratified the Convention on the Rights of the Child. I realize that's another story for another time, but just to say that all countries have these legal obligations to some extent. So what rights are we talking about? The rights that are contained in the international agreements that the governments of the world have agreed to all have relevance for health and well-being. So they include rights like non-discrimination, like freedom of movement, like the right to health. But all of them are relevant, if you think about it, to the underlying determinants of health, to supporting people not to get sick, and once they are sick, if they do get sick, to getting the testing, care, and treatment that they need, and to supporting people's physical and mental health on their road to recovery. So you see how much that is relevant to the current pandemic, beyond just the most obvious, which would be the right to health. And I would ask, again, thinking from people's experience, when you think about your review of the literature, when you think about what you read in the media, do you think that the right to health and non-discrimination and participation and other rights are being protected by all governments of the world in the context of the pandemic? I would say certainly this isn't the case at the federal level here in the United States, but I would ask you to think about all of the countries that you are knowledgeable about and the state, city where you live in this little thought exercise. And so just to be clear here, there are fundamental values that underpin human rights. And those fundamental values have to do with human decency. They have to do with the ways in which we conduct ourselves as human beings in the world. So I guess what I'm trying to say here is that you don't have to be a lawyer to see why rights are so critical to health. Rights are critical to health and well-being anywhere. And so now to talk a little bit about where we are in this current moment and what is happening around the pandemic for individuals, for communities, for governments. and for the UN system that are responsible for coordinating our collective action in terms of both health and rights. And I think the first thing I want to begin with is ourselves and talking about how are we all doing? All of us on this Zoom. Seriously, it's a real question. How are we doing with the pandemic, with physical distancing, with hand washing, with mask wearing, with sheltering in place, with safer at home orders, if you're still doing this where you are, or you're doing it again because the numbers went up and the regulations are back and forth, or there are limited or no regulations, but you know you need to take care of yourself and your family, even if the government doesn't put anything in place. And with all of this, how is your mental health? I don't think I'm going out on a limb by saying no matter how privileged we are, how lucky we are in terms of our material conditions that allow us to be part of this Zoom meeting, even if we're all finding this current moment difficult and stressful, right? And that's without the hurricanes, the fires, the earthquakes, the death of RBG, the craziness of politics with the UN within the US system. I mean, right, it's all of this, right? And all of this is occurring while we're also thinking then about how is it that we pay attention to and take responsibility for what's happening from in the context of COVID and how it is that we need to protect ourselves and our loved ones. And here, I just want to talk for a moment about physical distancing. Physical distancing seems like a very good idea, but just to give you one example of how this plays out in practice, and I'm going to move beyond the US here and in many of my examples, but I would like to ask first quickly whether my slides have appeared yet, and if they have not, just to please tell me.
Sophia, your slides have not arrived yet.
Thank you. All right. So here we go. All right. So just to say that from a public health perspective, it may seem a good idea to suggest physical distancing. But can you imagine what happens when you suggest physical distancing and you put a regulation in place, for example, that says that you're going to limit only 6 people onto public transport, but that normally takes 30 people. But then the owner of that public transport says, well, if it's only going to be 6 people that are going to be on here, I need to raise the prices, because by raising the prices, I can ensure that I can get the resources that I was intending to get from 30 people. The implication of that, those 6 people are not going to be able to afford that public transport. Now, you can imagine the health official making this decision because of their perception of what's needed to maintain the health of the community in the context of the virus. I mean, I can imagine the conversation. Let's restrict the number of people who can travel at any one time to keep people safe, until you think about what's happening with that. It makes it clear, I think, that it's much more complicated than simply thinking about health directives on their own in a vacuum, without attention to the larger economic, social, cultural, and political context in which the regulations happen. And thinking about enacting physical distancing regulations more generally that tell people they have to remain 6 feet apart or 2 meters apart, what does that mean when you live in conditions with 30 people sharing one crowded area? How in the world do you make this happen? And when I was asking earlier about how is it that each of us is doing right now, and I was thinking about how many of us are living with a shelter in place or a safer at home directive, you think about how this is happening in real time for people around the world, and the directive is often don't leave your house for weeks at a time. But think about what it means for real people and the what ifs. What if you can't stock up on food? What if you live with an abusive partner, which across the world, as I think everybody knows, there are reports of violence in the home that are skyrocketing? Or you need to get to the pharmacy to get medications because they're not available. What do you do in that case? And what is the government's responsibility here? The government who put into place orders that say that they need to be in place at that point, what do they need to do to make this work? What sort of resources are needed for all people, no matter how poor or vulnerable, to have access to the medications, to the food, to the rent being paid, to all the things that they need to have in place? How much of that goes beyond the purview of the health sector? So do you see that what I'm getting at is that addressing the virus really isn't just a health sector issue? I mean, in this current moment, we need to think about what ministries of health are saying, but we need to think about national level responses generally. And just to think in terms of kind of what's happening, do you think people are getting the same access across the board to PPE, to ventilators, to access to needed medicines? I mean, I know in the US we have a pretty bad record for this, but I think these are issues of concern everywhere, wherever we live. But the reason I'm asking the question isn't just to think about what those issues are, but what is needed at a governmental level to make sure people have access to these issues. So purely at the level of making this happen, there needs to be the science and evidence behind a decision that's made by government. The decision has to be written out in some form by some body. The regulation has to be passed by a body with the authority to do so. Resources have to be allocated. Those responsible for implementing it have to be trained. There have to be directives that are made known to the general public, and there's a lot of steps. But what does it actually mean to implement each of these and to do it well? In the current moment, the issue is these things are happening very, very quickly because the pandemic is real and there is a real urgency. Yet that's only part of what's being done across the world at the governmental level to address the virus. What else is being put in place are curfews, are restrictions on freedom of movement, are closing of schools and university, closing of bars and restaurants, closing of shops, a whole range of actions that are being put in place. What does it mean to implement these, to impose them? And the question then is, what part of government is responsible for doing that? Is it the health department that's responsible for imposing these curfews? Is it the police? Is it the military? And again, I want to start from the perspective that what governments are trying to do, they're trying to do the right thing in an impossible situation. But nonetheless, when we think about this, perhaps even with the best of intentions, how these are playing out in practice are really difficult and really kind of problematic. And I want to give a few examples. And again, I'm sorry that I'm not able to share my slides, but I'm not going to name specific countries, but you can easily find the information if you're curious. But these are just things that are happening in the context of the response to COVID. In one country, 1.3 billion people were mandated not to leave their home for any reason for 3 weeks. In another, more than 25,000 people have already been detained for not complying with the quarantine order that's in place. And across the globe, literally, there are close to hundreds of thousands of people that have been detained for non-compliance with stay-at-home orders. In several countries, we know that thousands of people have been beaten by the police and arrested for non-compliance with these orders, and then immediately let go because they didn't have the facilities to hold them. Within the same week, in one part of the world, just last week, a man was found beaten to death hours after he was arrested by police officers for not wearing a face mask in public. And in another side of the world, a woman was found beaten to death by police officers for exactly the same reason. A huge number of countries have also passed emergency laws that punish people for potential or perceived COVID exposure. And that's as opposed to actual exposure. And they can be prosecuted for an offense, including assault, attempted murder, or murder. There are literally hundreds of people around the globe who have already been charged with this offense. And just the way the penalties are written is very intense. Just as an example, in one country, the law says anyone who's found to be outside breaching the COVID lockdown could face 21 years in prison. In several countries, again spanning different parts of the world, healthcare workers who speak about the virus, and in particularly the inability of this health system to handle the number of cases coming in, speaking to the press, or on social media, are being arrested, they're being charged, and they're being detained for, quote, spreading false news and for, quote unquote, terrorism. And let's talk about contact tracing using phone apps for a moment. This has been introduced in law as part of the coronavirus response. But the question is, should it be permanent? Contact tracing is a vital part of controlling the COVID pandemic. But what does it mean that these data are being collected? What might happen with the data gathered? Who does it go to? And what does it mean for monitoring people's movements and contacts over and above the specifics of COVID? If cooperating with contact tracers might mean getting surveyed by the police, in the US, a study's already shown that people are not going to cooperate, but it's happening anyway. And on a more basic level, in another country, what about an app that worked for monitoring and contact tracing during the virus? Should it be taken off people's phones when the virus is under control? Or is it okay that the app is used by the government to track people's personal health status, lifestyle choices, in the name of public health once the virus is no longer a threat? Who should have access to this information, and who should decide? And I do need to say that the virus has also allowed politics to be played out in ways that are kind of concerning. For example, in shutting down health services, even if provided for in the law, simply because they're deemed not essential. And as one example, Texas has shut down all surgical abortion services on the grounds that they are not immediately necessary, not immediately medically necessary. And the Texas decision was made because, and I quote, "Stopping abortions will help free up the demand for personal protective equipment like gloves, masks, and gowns." Now, Planned Parenthood has filed a lawsuit in Texas about this, but this is an example of where they use, and the governor uses, the pandemic, a global health crisis, to try to end abortion access, even though it's legal. So these are the sorts of things that are happening the world over. And I literally have hundreds of examples I've been collecting from around the globe over the last few months. But I'm providing these only as examples, and I want to ask you to think in each case, of all those examples I just gave, what was the law that was being followed? How was it financed? Who was trained and responsible for enforcing it? What are the human rights impacts? And most importantly, whenever we're thinking about these government actions in the name of COVID, what's the rationale for these measures in addressing the virus? How effective is it in public health terms? And just to be clear, going specifically back to human rights for a second and the links between human rights and public health, there is a global human rights standard that can help in assessing the sorts of measures that are appropriate. The human rights framework basically recognizes that it can be legitimate to restrict rights for the sake of public health. Interfering with freedom of movement when instituting quarantine or isolation from COVID on a limited basis is an example of a restrictions on rights that could be necessary for the public good and could therefore be legitimate in public health terms and under international human rights law. But on the other hand, something which has been of much more obvious concerns are the more random measures that are being taken by authorities which restrict rights in the name of COVID, are not based on public health evidence, and that are more arbitrary or discriminatory in how they're targeted and how they're applied. But I say this wanting to be clear that interfering with most rights could legitimately be justified as necessary for public health. But the issue is, what is the evidence upon which these decisions are made? And part of applying a health and human rights frame is to be able to think about and apply these sorts of questions to being able to think about what is and is not being done by government. So just to close this section on what governments are doing, let me just say the virus is a public health issue, but should it be regulated by health law, by criminal law, by the police, or by emergency power? And who should be responsible for enforcing the law, and with what training and what resources and support? Now, I'm not suggesting it's clear in any one, there's only one way to do this in all circumstances, but I do ask that we're all aware of these points. And ultimately, shouldn't we be judging if these coronavirus measures are effective primarily according to whether they're having their desired public health effect? Shouldn't that be what we're focusing on? So just to say something quickly about global standards, and again, friends, I don't have my slides yet. Is that correct? I guess that's correct.
Correct. They didn't come through.
My goodness. Okay. All right. Everybody, please bear with me. All right. And I promise to share the slides, but basically to say that There is, first of all, the international health regulations that exist. And those international health regulations, which I would be showing you on the screen, should ultimately govern our response to the pandemic. They are promulgated by the World Health Organization in order to prevent, protect against, control, and provide a public health response. And it's a good idea in practice, and the international health regulations do pay some level of attention to human rights. So on the positive, the fact that these exist demonstrates the potential value of the United Nations. But on the negative with all of this, it's the UN that is made up of its member states, and it's only going to work to the extent that states comply and the extent to which states take it seriously. And while clearly that has been an issue, certainly within the United States and certainly in other parts of the world. So let me say that the first statement that came out from UN agencies initially around COVID and rights was from UNAIDS, which is the entity of the UN responsible for the UN response to HIV. And basically, what's important about it is it basically says that 40 years of responding to HIV has generated significant experience on the importance of human rights to ensure effective and proportionate response to epidemics. And that's wise, right? That seems like the ways in which governments should be behaving. The other thing that's happened is that the World Health Organization has taken the international health regulations one step further, and they've spoken specifically about the importance of paying attention to rights in the response. Well, why is that important? It's important because the WHO is therefore saying that for public health reasons, it's important to pay attention to rights. And again, not just because it's the nice or moral thing to do, but because it's going to improve health outcomes. And just, I have to say that despite the ridiculous attempt by Trump to pull out of the organization, they are the global organization responsible for health and well-being, for ensuring coordinated responses. And yes, they've made some mistakes, but ultimately they are and they should be trusted. And that's why a statement from them about paying attention to rights in the context of COVID is so important. Now, in April of this year, the UN Secretary General, which was really spoke out about COVID and spoke out about the ways in which it was important to pay attention to rights, and particularly after countries around the world starting to put into place the sorts of laws I was talking about earlier. He said specifically that COVID was no longer just a public health crisis, it was fast becoming a human rights crisis, and that the point is that the crisis can provide a pretext to adopt repressive measures for purposes unrelated to the pandemic. And that is something we all have to watch out for. So let me begin to wrap this up. Slides or no slides, let me try to wrap this up. And I think it's undeniable that human rights matter for COVID, and more generally, there's a legacy there, and it's important that we build on the legacy of rights in the context of public health, and that we don't abandon it. And as we move forward, we really need to be thinking about the questions that paying attention to rights offer us. What ultimately can paying attention to rights offer as we think about COVID and its legacy on our lives and our institutions, both within our communities, but also globally? And how do we make sure that our response to the pandemic, and any in the future, because we know there will be, seek to optimize both public health and human rights, because it's the right thing to do, but also because it's the most effective. It's a lesson we learned from HIV, and one we shouldn't have to keep relearning every time there's a new global crisis. And well, what's it going to take to get us there? A couple of things I want to leave you with in closing. First of all, these new harmful COVID laws have to be challenged. And some of this is starting to happen, but it's got to be a focus in the next few years, documenting and then challenging the harmful impact of these bad laws, and then doing all the work necessary, which is going to include training, not only of police and the military for how they can better implement the laws, but of advocates so that they can challenge them, but also of lawyers and judges on the science and on the lived experience to give them the information necessary to repeal these bad laws. Second point is that COVID has raised awareness of inequalities in health in a way that nobody's quite seen before. And that's a really good thing. There's attention to inequalities in health at a global scale in ways that I have not seen yet in my professional experience. And that's a very good thing. but it's also made it clear that public health is rarely separable from politics. And we really need to be vigilant about this. We really have to watch the ways in which the meaning of national security is being recast. What does it mean for health and security to become so intertwined? The pandemic has allowed the architecture of surveillance and social control to expand in the name of public health. And I do believe that this is something we need to address and be cognizant of. Recognizing health as a right moves us away from simplistic solutions and towards addressing the larger underlying determinants of health that have always been there, not just because it's the right thing to do, something that clearly hasn't worked so far, but because it will be the most effective. A society committed to human flourishing, which entails recognition of all human rights, has to be amongst our highest concerns. And I just want to end on the positive, that COVID is a reminder not only of the global connectedness of the pandemic, but also of its collective solutions. There's a clear need for the very structures and systems that support global health and that support human rights, and that my government and others are right now trying to dismantle. This is key. I hope you agree with me that we cannot let that happen. As we work towards a return to normalcy, albeit under no circumstances a return to the status quo, let's agree that no matter what our discipline or particular area of focus, to all work together to ensure the rights, health, and well-being of all people everywhere in the world and without distinction. Thank you very much.
Debbie, you're muted.
Debbie, you're muted.
Thank you very much, Sylvia. It was terrific, and you should really not worry about speaking without slides because it was terrific. And we really appreciate all that you had to say. So the next person to speak is Dilma Yearwood, who is the department chair, professional nursing practice at Georgetown University. And I'd also like to say, give her a shout out because she's also the secretary on our board, the Global Alliance for Behavioral Health and Social Justice. She's a certified child and adolescent psychiatric mental health clinical nurse specialist with over 40 years of clinical teaching and research experience. She's also co-chair of the Global Alliance for Behavioral Health and Social Justice's Global Mental Health Task Force. And she will be speaking on the fundamental elements of ensuring good mental health for all global citizens.
Thank you,
Dilma.
Debbie. Thank you. First of all, I would like to thank our moderator, Dr. Walker, and to congratulate Dr. Gruskin for receiving the 2020 Heyman Award for her tireless work in the field. Your presentation, Dr. Gruskin, is inspiring, and it affirms what we in the field have been working on and continue to work on. So thank you for that. And I just want to give a shout out to the person who's going to speak after me, Miss Mia Campbell, who, believe it or not, was a former student of mine and has gone on to do some amazing things. And I feel like a proud mom, Mia. You're doing wonderful work. I think what you might hear from us today is this constant theme. I think the COVID-19 pandemic has served as a wake-up call to all of us who work in this field. I think what COVID has really uncovered for others who are not mental health or human rights advocates is, I think everyone is seeing what we have seen for a long time, what the underlying problems, structural issues are. So COVID, I think, has allowed other people to see what we have seen and what we have been struggling with for many years. So I as a psych nurse, I want to sort of remind us that COVID has also increased the number of folks across the globe who are dealing with issues of anxiety, dealing with issues of depression, and we've seen the number of suicides going up. So we do have a lot of work to do, and I really want to remind everyone that we're going to probably, for many, many years to come, be dealing with the aftermath of COVID-19, because I think we've been seeing some challenges with our younger population. I think we need to really spend some energy and thought about how we help kids because of course they're our future, but they are also experiencing something that they were never prepared for. And so I think we need to keep track of that, because I think we're going to start to see many more challenges and problems with that population, young people. I want to just go back to one of the wonderful comments or signature messages from the World Health Organization, which is that there can be no health without mental health. And I think it sort of helps to ground me, and I hope it helps to ground you in the fact that we always have to keep in mind that when we're dealing with health conditions, we have to look at both pieces, the physical health, but also the mental health. These are intertwined. There is absolutely no way to separate these two pieces anymore. And so that's going to be important, an important foundational thing for us all to keep in mind. I also want to just spend a moment just talking about what do we mean by well-being? What does good mental health look like? Part of what makes up a good mental health perspective is the individual has to have a sense of purpose. So how do we help people look at and develop a sense of purpose? And how do we value that as part of this characteristic of all human beings? The other thing is there needs to be a sense from the individual's perspective that there's a harmony between their physical and their mental health status, as it were. And there should be a positive alignment with the social determinants of health. I think Dr. Grushkin mentioned this before, and I think that we can't forget that the social determinants, which are all those external factors, have to be part of what we as advocates and strong advocates, that we have to also pay attention to those social determinants of health. And we need to ensure a space where everyone who needs our support in expanding their mental well-being, that we are paying attention to those external factors so that we can help to support their growth and their move towards a positive mental health space. So the other pieces of those social determinants of health are things like, having an economic grounding, having a good, safe place to live, having social connections. How do we develop in communities places where people can feel like they can go and have a social connection, that they're being heard, that they're being cared for, that they're being valued. So I think when we look at the determinants of health factors, we as advocates need to also try to work to ensure that those exist in all communities so that the individual can focus on what they need to work on for themselves. And the things that the individual needs to work on are things like self-concept, self-esteem. I talk a lot lately with my students about the importance of mental health literacy. How do we help people understand their challenges, their behavioral or psychological challenges? How do we as providers start to reframe the pathological language that we sometimes use when we talk about somebody having a condition like depression or anxiety? We need to take that out of our language so that we can also work to decrease the stigma that our population sometimes encounters. So we have to, in looking at well-being, we need to not only help the person develop a sense of purpose, but we have to take care, as I said before, we have to take care of the external social determinants factors. We also need to support the person's functioning in society. What are those things that we need to put in place to help them function to their optimal ability? So those are some of the things I think about when I look at well-being and mental health well-being. Going back to what was said earlier, I think when we look at human rights, the buzzwords for human rights are things like dignity. How do we work with people to ensure that we're treating them in the most dignified fashion possible? How do we treat people with respect? Those are things that are really key components of human rights. The other thing is, how do we develop a system of fairness? How do we make sure that all people in our communities have access to the necessary things that they need in order to flourish? And I think we all should keep track of that word, flourish. I think it's a wonderful word for us to use in this space. How do we support empowerment and independence? Because that's how you move people towards a sense of well-being and good, solid mental health. And then lastly, under the list of things that the UN Office of High Commissioner talked about as it relates to human rights is equality. How do we work to ensure that that we're leveling the playing field for everybody, so everyone starts out having the same access and has equal rights to a variety of different things that they need to maintain their positive well-being. So when I think about the fundamental things that we need to move mental health forward or mental well-being forward, I think about three buckets. So the first bucket is we have to look at people, right? So there are things in the people bucket. And then the second bucket we have is policy. We have a policy bucket. And the third thing is a resource bucket. So let me sort of break those down a little bit. In the people bucket, I look at things like how do we work as a community, a global community, to decrease stigma? We have got to really get rid of this whole stigma as it relates to people being labeled and having a psychiatric challenge and being demonized because of their psychiatric challenge. So we've got to really work on stigma and eliminating stigma. I'm not even going to say reducing anymore. I'm going to say eliminating stigma. How do we increase our mental health literacy in our community? We have to talk about the challenges that people have with their psychological state and with their behavioral impulses, perhaps. So we have to really, really help people understand what's going on and what are some ways that they can manage those times when they're being challenged by either a psychological or a behavioral issue. We also need to work to stress the importance of well-being. I think we don't do enough messaging for our communities about what is well-being. I mean, so it's not one thing for everybody, but there's a continuum. And how do we help people understand the continuum of well-being? And we all should be moving towards the optimal end of that continuum. And there's nothing wrong with being sort of in the middle or towards the end, the lower end of the continuum. But the goal is we should all be moving towards the top end of the continuum. And it looks differently at different times for different people, and that should be okay. The other thing, when we look at the people bucket, as I think about the importance of training people. I know that in the Lancet series that started back in 2007, there was a lot of talk about using your community workers, developing the skills of community workers. And I really, really strongly believe we don't have enough people resources, that we need to really look at how do we increase the mental health literacy of our community, but how do we train people who live in the community to deliver the message? They are there, they understand the cultural nuances, and so they can help us make all of our communities a lot healthier if we target people who want to help us with this work, train them up, and have them move the messages forward. So I think that that's part of our people bucket. And that also, as I said, it touches on the cultural aspect, because I think with this work, we can't forget that there are cultural differences across the globe, and we have to be respectful of working within the different cultural groups that we intersect with. In the second bucket, which is our policy bucket, I think we have a lot of things in that bucket. I know that financial resources are short globally, but I think we need to work smarter. I think we have an opportunity to integrate mental health into into primary health and into general health. And so what do we do to increase the mental health literacy of our workers who are doing medical care? I think that that's a wonderful opportunity, so that they're assessing and doing some very brief interventions for people who are coming to them with a health challenge, but they're picking up or they're assessing a psychological or behavioral challenge. We need to sort of increase the mental health literacy of that group. The other thing is that we need to strive to help governments put mental health as a priority in their public health agenda, and to really, really focus on shifting some of whatever financial resources there are within the country to mental health. We are not going to have a healthy workforce, or we're not going to have a healthy citizenry if we don't focus on mental health. So I think that that's in the policy bucket also. The policy piece also gives us an opportunity to pivot and train people from, high schoolers to all lines of healthcare workers to increase their training around mental health and supporting each other as a global community to be as healthy as we possibly can be. The other policy piece is how does the government, local and national governments, how do they address social determinants of health? Because we know that the external factors are going to impact the individual. And so we've got to work on those things also as we're also developing the individual. And then the last bucket is resources. I'm trying to be mindful of our time, is the resource bucket. And so that is going to call upon us to examine the current resource allocation and structures and to make shifts and to make some very intentional decisions that mental health is important and we have to put resources to mental health. In the resource bucket, I also put the importance of NGOs. How do we collectively get NGOs to work together to put mental health and mental well-being at the forefront of their work? Because they have an opportunity to help us do the right thing within communities. So I really would task those NGOs to get together and have one voice, as it were, with the focus on mental health and promoting mental well-being. And they also have an opportunity to help us develop the human resource pool, i.e. the training, i.e. the paying people for the work that they're doing, i.e. the recognition of the work that people are doing. I'm going to echo what was said before. I am an optimist. I think we have a lot of work. I think the work is complex, but I think we have an opportunity to really get this right. I think everyone around us is now aware of the challenges about mental health, given the COVID epidemic, and we do have an opportunity to seize this moment and move forward with some of the things that we know that will work. We need to focus on people, we need to focus on policies, and we need to focus on appropriate resources to manage these. Thank you.
Okay, thank you very much, Dr. Yearwood. I would like now to turn to our final speaker and last speaker at today's session, Mia Campbell, who is a research assistant at Columbia Spatial Epidemiological Lab. She's a budding global mental health researcher who is passionate about adolescent mental health and wellness. Her research and work is primarily focused on youth engagement and empowerment through community-based mental health interventions. Her next step, complete her independent research in India as a Fulbright scholar. We're looking forward to hearing you talk about your perspectives on global mental health, Ms. Campbell. Unmute, yeah.
Oops. Okay, can everybody see my slides? There's the very beginning. Okay, thank you so much for that intro, Debbie. It is an honor and a pleasure to get to speak with Dr. Gruskin and Dr. Yearwood. I'm going to take a few minutes to focus on youth mental health in the context of COVID, but my major takeaways, and I know I'm saying it at the very beginning, is the significance and importance of listening to youth, learning from youth, engaging youth, and encouraging them to act. So that's where we're starting. I think it's also important to kind of set the stage by defining youth. The United Nations and the World Health Organization, they have varying definitions of youth. One is looking at adolescents, one is looking at young adults. So I'm going to talk about youth and young adults collectively from the age of 10 to 25 years old. When thinking about youth, Dr. Yearwood already mentioned this, but the youth are our future. So why is it so significant to focus on them and their mental health? Well, there are facts that are a little sad sometimes to think about, but 50% of mental illnesses first present in individuals who are around 14 years old. And 20% of youth that are between the ages of 13 and 18 live with a mental condition current day. By the age of 25, I believe 40% of illnesses will present themselves. So in thinking about the long-term effects that these mental illnesses may have on young people that are growing into adults, it impacts their ability to develop, their educational attainments, as well as their potential to live fulfilling and productive lives. So if we want to make sure that we have the healthiest future possible, we want to ensure that we focus on our youth. There was a global survey that was conducted this April and May, actually, by the Decent Jobs for Youth and partners. And they were looking at the impact of COVID on youth employment, education, mental well-being, rights, and social activism. And the reason I'm highlighting the survey is because it collected information from 112 countries. Over 12,000 responses were collected. And the most affected groups were young women, younger youth, so we're looking at the age group that's below 15 years old, and then youth in lower income countries. Knowing that these are the most affected groups, I think as a researcher who's interested in this, and other people should be aware of this, because as we're studying the effects of COVID-19, these are groups that we should be focusing on. How are women impacted? How are children being impacted, as Dr. Yearwood mentioned, and youth in lower income countries, and being sensitive to the context that these individuals are living within is very, very important. The survey also found that approximately 17% of young people are probably affected by anxiety and depression, and their mental well-being was also lowest for young women and youth younger than 18. The Global Alliance earlier this year, or I guess that was like maybe a month ago, we actually conducted a conversation with graduate students. So this is, I went from looking at it in a global context and kind of taking a smaller global lens. And we had 11 graduate students that were representing the US, Canada, and Nepal. And we kind of just opened up the floor for conversation about how is COVID-19 impacting you as a student, as a young person, what are the different things that are happening? And the major takeaways were the impact of COVID on mental health, challenges and unanticipated consequences, including this lack of communication of expectations, transitional challenges for many of them who were doing clinical work, trying to figure out how can I be meeting with patients, how can I meet my hours, how am I going to be able to complete my research requirements, all these different things that came up, as well as the financial burden, and also increased experiences of symptoms of depression, stress, and anxiety. Some of the other takeaways were considerations for additional and continued support. Those were kind of requests and asks of the students to administrators, professors, and this is the piece where I think listening to young people is very, very important. I linked the blog for you guys to check it out, and it's also my resources. But I think making sure that we highlight the voices of young people and really take the time to listen and learn from them, we can make the best steps moving forward. Another point that I think is very, where are my things? There we go. That's very important to consider, and I kind of highlighted this a little bit earlier, is the future impact. COVID-19 is a new beast. It's not the first time that there's been a pandemic of this scale, but this is new. There are lots of different things to consider, but I think the space that we're in right now is such that we're primed to begin focusing on longitudinal studies, studying the impact of family dynamics, education, professional outputs, and the impact on the community and the well-being of young people. Again, the youth are the future. That's the only way that it works. So I think making sure that we take the time to really create cognizant and thoughtful studies that are paying attention to the needs. Again, listening, learning from, engaging youth, and then acting. I think those are some things that are really significant and important to consider when we're thinking about youth. The other thing that I think is really important is providing support to young people throughout this pandemic should definitely be a larger conversation, in my opinion. Their youth are resilient and resourceful, but to expect that young people, especially the very young people who are experiencing some traumatic experiences as a result of this pandemic, to expect that they will understand and be able to cope and just move forward, I think is very unrealistic. So being more cognizant about creating support systems for young people who are going through this. On the psych side, if you're thinking about adverse childhood experiences, we may be in for a world of trouble going forward just because of the impact of COVID-19 on young people. So I think that's something that's definitely very important to consider. If people have research that they're trying to figure out what to do, here's a topic. But I think that thinking about the long-term impacts of COVID, as well as figuring out ways that we can actively be supporting young people now, is very, very important. Okay, I was being mindful of my time, but those are the points. Again, making sure that, again, we listen to young people, that we learn from them when we're intentionally and actively listening, that we engage young people, remind them that they are significant, they are important in this conversation, that somebody is looking out for them, somebody cares about what they're thinking and feeling and the way that they're being impacted. And then taking all that information and putting it into action. If that means it's policy, if that means you as an individual are taking the time to connect with young people and talk to them, whatever that looks like, just find a way to act. Another thing that I think is important to highlight is if you're interested in having or engaging in more conversations like this and really coming together for action, we have our conference. This is a little spotlight for it, but our conference Together for Action is happening virtually from October 6th through the 9th. And those are the links for the conference if anybody is interested or you haven't registered already. And then
Okay. Thank you so much for that great presentation and that really emphasis on youth. And thank all the panelists. We have just a brief, I think, amount of time. I was going to ask Dr. Grushkin, you referenced that you were collecting all these laws from all over the world. Is this a research project, and will the answers to those be placed on a website, kind of a cataloging of those and what the impact on health is?
I really appreciate the question. And again, apologies for not being able to show them to you. But a few points about this. Not only myself, there's a number of organizations around the world right now that are collecting these and that are putting them all in one place together. What we're doing is we're engaged with some partners in a couple of different countries trying to document the harmful effects of these laws, specifically in relationship to particular populations. But we're only doing that in a couple of countries. What's important is that there are some large-scale databases. So for anybody that's interested, for your community, for the countries that you are from or that you work, you're able to access those. And I can put some of that information in the chat to make it available.
That would be great. And also how people can contact you, because I think there's a lot there. Just in the last couple of minutes, Dr. Yearwood, there are a couple questions here for you. And one was really about the youth mental health that Ms. Campbell spoke about. The question is, what sort of new challenges might we expect after the pandemic in terms of mental health? And how can COVID recovery efforts take these challenges into account?
I think one of the first challenges we're going to experience, and I think we all know this already, is financial. I think we are just strapped. Most countries are strapped because of the impact of COVID. People have lost their jobs. Businesses have closed down. So I think that I worry about resources being taken from mental health even further. We already were at the bottom of the list for resources in most countries. And I just think that with the pandemic and the implications from the loss of revenues from so many countries, that mental health services will take a hit from this. So I worry about that.
Okay, great. And thank you. And it was great to hear your call for bringing together NGOs. I think that's really a good possibility. And a couple of the folks in the chat you can see talked about how they could get more involved in their own countries in sub-Saharan Africa, etc. And also thank you to someone in the chat who offered free statistical advice. I just wanted to point that out. People should go there. And I just want to say again, this was really an excellent session and we thank you very much. Dr. Grushkin, congratulations. And believe me, you are a terrific speaker. You do not need slides. I just want to say that again. And we really appreciate all that you've done and helped us to kick off our first session, or the session in Coming Together for Action 2020 that will be held starting October 6th. We hope to see you there. Thank you very much to all the speakers. We're signing out now.